Hello, everybody.
Hello.
There-
Welcome back, everyone. Welcome back to another episode of Getting That Medical Degree. Today's topic we're going to talk about.
Is COPD.
All right.
If you guys watched the last videos on asthma, so most of the drugs in this video is going to be about the same as the asthma drugs, so I'm not going to go into much detail about those. So let's get into it. First, you have the grades of COPD, basically how, just telling you how bad it is. Pretty easy to remember these though. This is easy questions on the test. Be like, oh, this person has an FEV of 30%. Where are they out on the scale? That'd be severe. But mild is greater than 80%, moderate is 50 to 80, severe is 30 to 50, and very severe is less than 30. There's another scale they use, it's called an MMRC. That's just telling you like how they are with getting breaths in. So it assesses their breathlessness. We'll talk about it in the next slide. So category and treatment. So the categories are A, B, C, and D, with D obviously being the worst. So A is like a cat less than 10, with an MMRC, which is like the breathlessness, 0 to 1, and exasperation is like 0 to 1, which means like no hospitalizations needed for it. And for that, you'd use like a bronchodilator, like a SABA or a SAMA, PRN, or a LABA or LAMA. And then B is like a cat 10, so instead of a cat less than 10, it's greater than 10. MMRC is a 2, but you're still not being hospitalized, so you're using about a LAMA or a LABA for it. And then cat C, it's basically the same thing as cat A, but now they're being hospitalized for it. So then you're using a llama. And then cat D is the same thing as cat B, but you're being hospitalized. And then you basically use, if you're already on a llama, you probably want to do like a LABO on top of it, or like an ICS, which is like a steroid. These are just like easy questions you could get on your test. So yeah, you have to know that. That's how you treat it too. So they'll give you an entire case. They'll be like, oh, this person's been to the hospital one time. It's like, oh, if you miss that detail, you might mess up what the category is. So make sure you know that. Escalation of treatment. You have dyspnea. So if you're on a LAMA or a LABA, you want to add the other class to it. So you have to make sure you know there's drugs in those classes. And then you can also add an ICS if there's as aspirations. So not too hard there. Just knowing what to add to therapy. So the muscarinic antagonist or anticholinergic drugs, you have SAMA. So I'd say like a short-acting muscarinic antagonist. Ipratropium's that, and the brand name's Atrovent. Now, if you take ipratropium and you combine it with albuterol, that's Combivent. So it just gives those brand names and generics. A llama is what you probably see the most. That's tiotropium, which is Spiriva. So know that. And if you add a clendium to it, it turns into Tudorza, and that has like a window that turns green to red if done right. And with these agents, you're just worried about like dry mouth. Muscarinic antagonists always like dry the person out. So if this was a pill, it would be like causing constipation and stuff too. This is an inhaler, so it's called like dry mouth. Beta 2 agonists we talked a lot more in the last video, but Advair is a Salmeterol and formoterol. Symbicort is formoterol plus budesonide. And Brio is melanterol and fluticasone. Again, it's just emphasizing the known as brands. You need to know what Advair is, you need to know what Symbicort is. And lastly, you want to talk.
Is there like a list of drugs that you like? Do you have to memorize every single one of
Yeah, you pretty much memorize them all.
them?
I mean,
Okay.
it's called a list of like the top 300 drugs. I think it's like 350 now, and that's still a lot of drugs to know every single detail about.
Yeah, it sounds definitely A lot of them.
Like, these are just like the main drugs you'll see. Like there's like new drugs coming out every day for like every disease state.
Oh yeah, yeah. No, I figured.
So yeah, there is a list. There's like a top 300 drugs. I think the school makes us memorize. But you have to know like every detail for those, like all the side effects, like every single one, every brand name for it, every generic name for it. So yeah.
Jeez.
But there is a list. People, just, if you guys just Google a list of the top 300 drugs, you'll find a list of it to know. Or if you follow like a prep course or a course book, like RX Prep, which is the most like popular course book for Naplex, they also just go into detail about everything too, and tell you which ones to know. But then the last drug we have here is a PD4 drug. It's called Raphumolast. Main things in about that is it's contraindicated, which means you can't use it if someone has like liver issues. A CI on my slides mean contraindicated, so just in case you guys didn't know that. And the main adverse drug events is diarrhea and weight loss. So these are pretty important to know. That's it for COPD. I went more detail into asthma about the drugs, but this is just how you treat COPD, how you categorize it, and yeah, not too hard. Do you have any
Yeah.
questions?
Do you like whenever you get a case, like is it a shallow case? Like do you ever get like a more in-depth case giving you like what exactly do they give you?
So they could give you a simple question what says like, uh, here's a drug and what's the side effect of it, and they'll give you a case of the drug, but all you need to know is what the drug is. But they could give you an entire. They usually give you an entire case of every question, mostly. And the case could be like, okay, here's all the patient's drugs, here's all their allergies, here's all their lab values. Which drug is contraindicated, which means you can't use it.
Right.
So now you have to go through all the liver values, all the lab values, and figure out, okay, for this example, like PD4 inhibitors, Raphumolast, if their liver values are, was it 3 times the upper limit, I think, then you can't use this drug. So you go through the med list, go through the labs, and figure that out. That's usually how the test goes.
Does ever some of these lab questions or stories of patients did they ever put them on a tricky uh, semantic type thing?
Oh, they're all tricky,
Okay.
especially for infectious disease, because you read through the entire question, and be like, oh, I know exactly the answer. Then you got to read the case like 3 times, and like, wait, they have an allergy to all of the answers I know in my head. Oh no, what do I do? So yeah, you have to read every little detail. You only have like a minute and a half to answer every question if you want to finish one time. So
Uh-huh.
yeah, yeah,
Sounds intense.
it's a pretty intense test. I finished it with an hour and 45 minutes left, thankfully. So but yeah, read the question first, question prompt, and then read the case if you need to. Sometimes you don't need to, but it might as well if it's something really complex.
You said sometimes you don't need to read the case.
Yeah, sometimes they ask you a stupid question. It's like, what's the side effect of this drug, Raphumolast?
Okay, so that's a cool trick to have. Like sometimes you don't need to read the whole
But if the
thing.
but if the prompt is like, this patient is started on Raphumolast, what is a contraindication this patient might have to this drug? And then you have to read the case.
Okay.
But yeah, sometimes they just ask you like a side effect of a certain drug. Like, patient was started on a drug on March 2nd. What's the side effect from this drug? So you look at like the medication list real quick and figure out, oh, that's March 2nd. They started on Raphumolast. That's diarrhea or weight loss.
Right.
So stuff like that. Just read the question first and decide if you need to read the entire thing.
Okay, that's a good trick.
That goes for every topic, not just these ones we're talking about now. It goes for every topic on the entire test. So, any
All
other
right.
questions?
No, that's it.
Okay, guys, have a good one. Hope you guys learned something. Comment below any tricks you guys know from taking your tests or that you wish you would have known. So,
All
peace.
right. Thank you. Bye.